For those of you who already know me, I could probably stand up here and talk for a very long time, but we'll try to keep this short at this point. I really want to thank everybody for coming at this time for this really momentous occasion. You know, we've certainly had our vaccinations, we've certainly had our booster opportunities, but today represents another incredible day to represent the progress that we've made. We had a media briefing yesterday, and one of the questions that was asked to us was, even though the cases are rising, and even though we are having hospitalizations, how are you handling this? And how are you doing? And how are you able to handle the surge that is in the hospital? And we answered with two reasons. Number one, before it was the unknown. Remember the beginning, right? People were getting undressed on their front porches so they didn't bring any COVID into the house, right? We were afraid to touch our shopping carts. We didn't go anywhere. We didn't go to restaurants. We didn't go to sporting events. And now we know more about the disease, and we know about the mode of transmission. And we know how we can get this and how we can avoid this. But the other reason that we are doing good and that we are able to handle the capacity is that we're better. We're better at what we are doing. We are much better than where we were 2 years ago because we know more. Because what was the unknown is now the known. I do want to say that we don't know everything. And we don't know where this pandemic is going to go, what direction it's going to go in. I do have hope that by mid-January cases will start to decrease. But today represents another milestone. And I really want to thank, I don't want to call them brave kids, because there's nothing to be scared of to get your shot. So I'm going to call you incredibly intelligent and mature kids who know that this is the right thing to do, not just to protect yourself, but to protect your loved ones and those around you. I don't want to call it brave because there's nothing to be scared of. I don't want to call you brave, but I really thank you for coming here and showing that this is what it takes as a community, as Americans, that this is how we're going to beat this pandemic, and this is how we're going to get through this. So, as much as I have done during these last 2 years, I really want to thank the community for what they do. So, thank you very much. I appreciate it. So with this, we've seen a lot of press in terms of who can get boosters, and so this represents the next age group, and we do hope with further science, further data, further studies, that other age groups will be able to get this vaccine. And a lot of questions revolve around, well, is this going to be something that we're going to have to do in perpetuity? Is this something that we're going to have to continually do? Time will tell. The science will tell us. People will ask, well, why does the science always change? It doesn't always change. There are fundamentals that we believe in. But it goes back to what I said before in the beginning. What was unknown is now becoming known at this time. And because of that, we are able to take that data and make new changes in the science. But there are some fundamental principles that are very important if we are to get out of this pandemic. And that hasn't changed. And unfortunately, a lot of these fundamentals, people are tired of hearing about them, right? COVID fatigue. COVID brain is something new now because it's affecting all of us, even if we don't have COVID, because it is on our national and worldwide consciousness at this point. And sometimes you just don't want to hear about it. I know every single time I hear myself on the radio or TV, I turn it off because I don't want to see me. I don't want to listen to me. But the reality is, the same basic principles apply. And that is vaccination. That is boosting. That is masking. That is social distancing. And that is putting yourself in the right social situations to make sure you don't put yourself at risk to get COVID. And so one of those numbers applies to these incredibly smart, intelligent, mature kids. And again, I thank you so much. So I'll end it there. Happy to take any questions Or are we doing? Okay. Okay. Give me another look. All right. All right. Colleen Tevan is one of our incredibly smart and hardworking pharmacists who I couldn't have done any of this without her. She has been amazing through this entire pandemic. She is my COVID muse. So I appreciate all that she's done. Awesome. Thank you. I don't know if this is the age where we transition from superhero Band-Aids to regular Band-Aids, but we only have the regular ones. Sorry.
I just want to say thank you for Hartford HealthCare for making this real and possible and making it happen. And with the new year, we have if you get your booster and you're vaccinated, we have a new year and a new outcome for COVID, hopefully. So thank you.
All right.
Hello, everyone. I am Charles Jamison Muro, and I'm in Connecticut. I just got my booster, so let's go. Woo! I heard that a lot of people are confused about why I have to get another shot. Why do I have to I already am vaccinated. Why do I need this new one? And a great way to put it is it's just like a helmet or a seatbelt. You may crash, you may fall, but it's just that much more protection when you do crash, or if you do crash, or if you do fall. So it's really just that extra push to get us out of this pandemic. And with the new year, it's looking very good for us. So stay strong, America, and let's keep going.
You got to give me the other.
Hello, everyone. I got the COVID booster shot because my aunt is an ER doctor and she told me to get it. Thank you.
I feel like I should have a biography on everybody and be like introducing, and now representing, no. There we go. Yes. Standing 5'10", weighing 120 pounds.
A bit shorter.
Okay, thank you for coming. Talking. Thanks for coming.
Hi, I'm Mia Scranton, and my mom is immunocompromised, so the shot means a lot to me, and I'm really grateful to be able to get it.
Elbow. I think there are many different reasons to get a vaccine. A lot of it is personal choice, but I think what you're seeing, and this speaks to the maturity, is that we do understand that there is a societal responsibility. This is what we need to do to pull together as a society, and hopefully the kids can teach us something about this, because you're hearing a lot of different reasons, but a lot of them are doing it not just for themselves, but for family, and that's incredible.
Hi, I'm Izzy Albert, and I just wanted to say that I'm so lucky to get my booster today so that we can get through this pandemic. Thank you.
Elbow. Are you a lefty? I was just curious. Everybody's gone lefty, except you went righty, so.
Thank you for keeping my family, my friends, and my teachers safe. And let's hope I get to school on time.
Anything else? Happy to take any questions if anybody has any.
Dr. Wu, what do you think, and you may not be able to speak to this necessarily, but we saw this happen really quickly this week in terms of approval for this age group. What are your predictions in terms of what we might see this year for the younger age groups?
I think that's a very good question. First of all, nothing happens quickly, so it seems like it was quick, but really a lot of science and a lot of deliberation, a lot of meetings have preceded this to come to this decision. And the same thing is going to happen going on with some of the younger age group, which is what I think you're alluding to. The reality is that the science and the data is very important, but there is also the optics, because we're vaccinating young kids. And even though the science says that it's going to be safe, they're also going to be very deliberate and cautious with their recommendations, even though the science says it's safe. So I would expect that within the early, well, we are in early next year, so I was going to say early 2022, but my time clock is off. I think in the next few months, we're probably going to see more of these decisions that are going to be made. I don't think it's going to be put off until the end of the year.
Dr. Wu, can you just talk a little bit about, again, what does this mean that this age group get the vaccination and get it now? Let's talk about what this means. I mean, the past few weeks, we've seen cases rise. So talk about what this means that they're getting the vaccine.
Well, so we've always talked about vaccination as being a way out of this pandemic. And the reality is vaccinations, although one of the benefits is to really, I'm going to say, prevent transmission, its real main benefit is to actually keep people safe and keep them out of the hospital. But preventing transmission is one of those things that vaccines do. So if you look at the population as a whole, we talk about the markers in terms of percentage of people that need to be vaccinated for us to make a dent in this pandemic. And so by vaccinating a whole nother age group, which is, going to be 5 million, that represents another hole that we can close if we can vaccinate them, so we can prevent transmission, not necessarily amongst the kids themselves, but to people, as you've heard, the reasons that they gave why they're getting vaccinated, to those who may not do well with the vaccination. So that's why it's important.
So speaking of hospitalizations, well, can you say what hospitalizations look like now? Do you think they may go down as a result of these kids getting vaccinated over the next several weeks?
Absolutely. I do think that this is going to contribute to a decrease in hospitalizations, amongst other things that are also going to cause a decrease in hospitalizations as well. So unfortunately, I'm not a pediatrician. We do know that across the country, well, I'll start with HHC. We don't actually have pediatric patients, but we do partner with children's across the street. But we do know that hospitalizations are increasing across the country. And that's not necessarily due to lethality or the deadliness, but just by the sheer amount of numbers that are being affected by Omicron right now at this point. So it's really, a lot of it is numbers, though there are some who are probably not doing well.
Are we seeing that as a benefit overall?
It's tough for me to say, but I think Connecticut does tend to mirror. Sometimes we actually tend to be first because of our urban concentration in terms of our population density, that not only do we mirror, but we sometimes lead that. So I would expect within the state of Connecticut, we do have that increase in pediatric hospitalizations as well.
What happens after this group of 8 kids right now? How do we work on vaccinating the rest of the population in this age group?
I think that's a great question. I actually don't know the actual logistics, how this is going to be rolled out, but it's going to be offered through a variety of sources, whether it be primary care, whether it be pharmacy outlets, whether it be hospital outlets. But yes, there will be access to this.
And last question, you answered a little bit of it earlier, but why kids, especially with boosters,
So we know that with Omicron that boosters is going to be your main source of protection. We know with a primary series that you're only going to be very partially protected against Omicron, and that booster will allow them further amounts of protection. So boosters are not just important for the age group, but for everybody.
Also, Dr. Wu, you just talked about over the past couple of weeks, we've obviously seen a regression in some way with now people talking about going back to remote learning, whether it should be in school, not be in school because of the rise of the COVID cases. How do you think this is going to impact that discussion of how we move forward in this movement?
I think it's going to impact it in a positive way. I do believe that, classroom transmission is fairly low, but it's outside of the classroom, whether it be the social activities, whatever else happens in school is the transmission that we worry about. But like I said, boosters its main intent is to keep people safe and out of the hospital, but we do have a secondary benefit with a decrease in transmission. If you can imagine people not getting their vaccinations and boosters during this whole entire time, where our hospitalizations would be, where our case rates would be, we would be completely overwhelmed without them.
And I know this is kind of similar to what I asked earlier, but we were talking this morning about shortages in the hospitals also too, in terms of staff. Staff getting sick, they have to work at home, grandchildren.
Yep.
Do you think this is also going to make a dent when it comes to that too?
It depends on everybody's definition of a dent. It's going to help. I guess I will say that it will help. Happy to take any other questions. If not, I'm also happy to leave the stage. Okay? Thank you. Thank you for coming.